Okay, so I did count 8 respirations for 30 seconds, which puts you at 16 respirations per minute, which puts you at the normal range, which is between 12 and 20.
Okay.
I also did notice that you didn't have any nasal flaring, no pursed lips, no use of any accessory muscles or intercostal uses around there, so everything looks unlabored, which is a good thing. So now I'm going to go ahead and have you facing the wall over there. I'm going to go ahead and inspect your posterior side of your lungs, okay? Okay, so you're going to feel me touching you. It's just going to be palpating you for any masses or tenderness, okay? At any point, just let me know if anything hurts. Okay, so I didn't feel any tenderness, no masses, everything feels good. And now I'm going to go ahead and check for chest expansion, okay? You can go ahead and take a couple of deep breaths. Okay, so chest expansion looked even, pretty good. So I'm going to go ahead and also perform tactile formitis. Every time I press down, can you just go ahead and say the word 99?
Yes. 99, 99, 99, 99, 99.
Okay, so I did feel resonance on the top of your chest, and at the bottom it was pretty dull, but that is normal, okay?
Okay.
I'm also going to go ahead and percuss the back, okay?
Okay.
So you're just going to feel some light tapping. So again, resonance at the top, dullness at the bottom. I'm also going to ask you to go ahead and lift up this arm. I'm going to go ahead and palpate here for any masses. Everything feels good. And I'm also going to go ahead and percuss as well. Okay, everything sounds and feels good as well. So I'm also going to go ahead and auscultate to hear your lungs from the back, okay?
Okay.
So I'm going to go ahead and sanitize my stethoscope. Okay. Okay, if you can just go ahead and take a couple deep breaths for me, okay? I'm going to go under your shirt just slightly, okay? Okay. So now I'm also going to ask you to lift up this arm, and I'm going to go ahead and hear for those sounds, okay? Okay. So everything did sound good. There was no obstructions with your breathing. Everything sounded clear, okay?
Okay.
Okay, so now everything that I just performed on your back, I'm just going to perform the same thing on your chest, okay? So I'm I'm just gonna go ahead and feel for any masses or tenderness. At any point, if you feel anything, just let me know. Can you go ahead and lift up? Yep. Thank you. Okay. Everything feels good. Are you able to go ahead and lift up this arm for me? Okay. So now I'm just gonna go ahead and do for chest expansion. Feel for chest expansion, okay? So if you just, yep, and then go ahead and take a couple deep breaths for me. Okay, awesome. So your chest expansion was symmetrical. Now I'm gonna ask you to state 99 every time I go ahead and palpate, okay?
99, 99, 99, 99, 99.
Okay, awesome. So again, resonance at the top, dullness at the bottom, which is completely normal. And now I'm gonna go ahead and percuss your lung fields. Is that okay?
Mm-hmm.
Okay. And now I'm gonna ask you to go ahead and lift up your arm again, and I'm gonna go ahead and percuss 3 points over here, okay? Okay, awesome. Again, resonance at the top, dullness at the bottom, which is completely normal. I'm gonna go ahead and auscultate, which is just listening to your lungs, okay? I'm gonna go ahead and sanitize my stethoscope again. Better safe than sorry. Okay. Go ahead and take a couple of deep breaths for me. Okay. So I do hear some bronchial sounds. And as I go lower, I'm hearing some bronchial vesicular sounds. Are you able to go ahead? And now as I go lower, I'm hearing some vesicular sounds, okay? Completely normal. And are you able to lift up your arm? Thank you. Okay. Everything's cleared up. Sounds pretty good. Again, like as I stated, some bronchial sounds at the top of your chest as I went lower, bronchovesicular. And then as I went lower, some vesicular sounds, which again clears out as normal. And now this goes ahead and concludes our assessment. Also, I forgot to state that there was no adventitious sounds either. So nothing out of normal, no murmurs, no nothing. So everything sounded pretty good. Correction, murmurs is cardiac. So do you have any questions before this assessment concludes? No? Okay, so then I would go ahead and make sure you're in a comfortable position. You have your call light, and then I'd be back in about 30 minutes to an hour to go ahead and do rounds on you, okay?
No signs of pendiculosis, no signs of abnormal findings, lesions, or tenderness. Okay, Miss Monica, do you have any vision problems? Do you wear any glasses? Do you have any blurry vision?
No, I don't.
No? Okay, so I'm going to assess your face. And do you experience any pain?
No.
Palpitating your ears? Do you experience any pain in your ear?
No.
No? Okay. So the patient's face is symmetrical bilaterally. Eyes are symmetrical. Nose is within the line. Okay, so I'm going to assess your eyes.
Okay.
Before I assess your eyes, make sure there's any ear drainage.
Okay.
And have you experienced any ear drainage in the past?
No.
And can I have you look up your face?
Oh, sorry.
Mucosa is pink. Now we can have you look straight. Okay, I'm gonna have you follow my pen. Okay, patient's eyes are round, equal, and reactive to light and accommodation. Okay. So I'm gonna have you look straight to my finger. Okay. I'm gonna have you look at a distant object. Okay. Patient's nerves 3, 4, and 6 are intact. Then I'm gonna have you have a sip of water.
Okay.
Have a sip of water again.
Okay.
Okay. Trachea is intact. Can you open up your mouth and say ah?
Okay, go ah.
Okay, there's no swelling in tonsils and mucosa is pink and moist. Okay, I'm gonna have you open and close your mouth. Okay, there's no signs of popping or
I'm sorry.
no, you're fine. There's no signs of popping or disorientation of the TMJ. Okay, I'll be palpating your lymph nodes and
Okay.
tell me if you experience any pain.
Okay.
Did you experience any pain?
No.
Okay, so there's no signs of firm lymph nodes or masses within the lymph nodes. Everything was fine. Okay. Have you had any problems with your respirations or anything?
Not at all.
Okay, so I'm looking at the patient, and the patient's not using any accessory muscles to breathe. Okay, so I'll be checking your respiration. You can see your chest expansion. Okay. Chest rises and falls bilaterally. I'm checking for AP ratio. AP ratio is from 2 to 1. Okay, so I'll be checking for your respirations. I'll have you breathe in and out every time I touch you with my stethoscope.
Okay.
And lift up your shirt.
Okay.
So something back. Patient's respirations were normal. No signs of wheezing, crackles, or stridors. Okay. Now I'll be checking your brachial, your radial, and your pedial pulses. Checking your brachial, your radial. I'll be checking your pedial. Okay, then I'll be checking your cardiac pulses. So patient's pulses were all within normal rhythm. There was no weak or thready pulses, so everything would be categorized as 2+. Okay, so I'll be hearing your heart sounds.
Okay.
Okay. So I'll be starting with your aortic sound.
Okay.
Your pulmonic. First one. Tricuspid. And mitral. Would be categorized the point of maximal impulse, also known as the apex. So within the patient's heart sounds, there was no abnormal findings. Everything was strong. Okay, so I'll be testing your range of motion. So can I have you turn your neck from side to side? And I have you look up and down. And can I have you raise your shoulders up and down? Thank you. And have you noticed any signs of edema, swelling within your extremities?
No.
No? So I'll be checking extremities. Sure there's no edema, there's no swelling. Okay. And have you had any changes in your bowel movements?
No.
When was the last time you had a bowel movement?
This afternoon.
Okay. And then have you lay flat on your spine? Okay. So there's no abnormal findings. Patient's stomach is flat. Now I'll be auscultating your bowel movements. I'll be listening to them. I'll be starting from your right lower quadrant and moving my way all the way to your left lower. So patients' vowel sounds are normal active. They all rate from between 5 to 30 per minute. Now I'll be palpating. Doing a light palpation from 1 to 2 centimeters. Okay, there's no superficial masses. Now I'll be doing a deep palpation. And there's no masses found. I'll be palpating and percussing. So patient's stomach is tympanic. Can I have you lay? Can I have you sit up again?
Yeah.
And have you had any trouble walking? Walking anything?
No.
Okay, can I have you stand up and I'll have you walk back and forth?
Okay.
thank you. Now have you sit back down.
Yes.
Okay, and I have you press your shoulders against my resistance. Okay, thank you. And have you press your arms against my hands. Okay. And up. And have you press them out against my resistance and press them back in. Okay, so patient strength is ratings from 5 to 5. And then I can have you again just shrug up and down. Do you experience any tenderness?
No.
Raise your hands up, and down, to the side, and down, forward. And keep moving back. Do you experience any pain?
No.
Can you stand up?
Yep.
Can you move your hips, look around? You move up, bring them to your chest. And chest. Do you experience any discomfort?
No.
Okay, then I'm gonna have you sit back down. And can you move your wrists around? Do you experience any?
No.
I'll be checking your reflexes.
Okay.
So I'll be checking your patellar reflexes.
Yeah.
I'm checking your Achilles reflex, so I'll just have you relax down here.
Mm-hmm.
Okay, Christina. So first we're going to start with holding your
Thank you.
wrist up, your arm up like this. Perfect. And if you can flex your hand forward all the way, just like that, and hold that position for me. Okay, thank you very much. And with your elbow staying right where it is, if you can, please fold your wrist back as far as you can. As far as it goes?
Mhm.
Okay. Fantastic. Thank you very much. Okay, Christina. Now what I need you to do is move your hand, keep it flat on the table towards your pinky as far as it goes. Okay. Excellent. Is that as far as it goes?
Yes.
Fantastic. Now the same thing, but towards your thumb this time. Great, thank you. Okay, Christina, how are you?
Good.
Good. All right, you ready?
Yes.
If you could put your elbow on the table and hold it up about 90 degrees, great. And make a good fist for me. Okay, you got a tight fist as far as it goes?
Yes.
Take a few measurements. Great, thank you. Okay. Now, if you can, same position with your elbow and make a bear claw kind of like this. Great, thank you. Perfect. And just hold that position for me. And we're going to try this side. Okay, thank you so much. You can relax. All right, Christina, can you turn your palm up for me? All right, fantastic. Now what I need you to do is take your pinky finger and hold it up against the slide ruler and slide all the way down as far as it goes. Perfect, thank you. We'll try with this one. Great, thank you. Next, middle finger. Perfect. Index finger. Fantastic. Good job. Okay, Christina, so we're going to measure some thumb movements, if you can. Make an L with your thumb, have it out as far as possible. Fantastic, thank you. Great. Now put your elbow on the table and have your arm out and pull your thumb in for me. Excellent. Good job. Now, if you can, I need you to keep your hand in the same position and bring your thumb in. Great. Thank you. And one more right here. Perfect. Thank you so much. All right, Christina, can you touch your thumb to each finger for me like this? All right, perfect. Thank you. Okay, we're going to now try to measure some strength in your hand and fingers. So this will be a little bit different. Okay, what I need you to do is keep your palm up. Great. Now flex your wrist to where it's facing you. Perfect. Now roll it towards your pinky side as far as you can. Okay, perfect. Now hold it there. Do not let me move you. Perfect. Good. Now back up and toward your thumb. Hold it there. Do not let me move you. Great. Good job. Okay, Christina. So now what I need you to do is to raise or extend your wrist backwards as far as it goes. Great. Now towards your pinky, if you could roll it for me. Great. Now just hold it there and do not let me move you. Perfect. Okay. Now the same exercise. Wrist up, but I want you to roll this time towards your thumb. Hold it there. Do not let me move you. Excellent. Now, if you can, lean forward all the way in towards the table. And we'll tuck your arm a little bit there. Perfect. And again, I want you to raise your arm up towards your thumb. And don't let me move you. Good job. Thank you. All right, Christina, we're going to start testing some strength in your fingers. If you could turn your hand over for me. Excellent. Now, what I'm going to need you to do is bend your pinky finger up towards you as far as it goes. Okay. Excellent. Thank you. Now your ring finger. Try again. I'm sorry. Excellent. The middle finger. Okay. And index finger. Perfect. Good job. Now we'll do the same thing, but this time just towards the tip of your fingers. Go ahead. Pinky. Good. Ring finger. Excellent. Middle finger. Good job. And index. Perfect. Great job. You can relax. Okay, Christina, so what I need you to do is have your palm facing up, flat on the table. Perfect. And if you can, roll your fingers up towards yourself. Perfect. Now I want you to, one at a time, hold your finger there. Do not let me move you. Okay. Hold this finger. Do not let me move you. Excellent. Hold this finger. Do not let me move you. Good. And hold this finger. Do not let me move you. Excellent. Good job. All right, Christina, if you could for me, raise your elbow, so like this, and make a bear claw again. Okay. Excellent. Hold this there. Do not let me move you. 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 Excellent. I know you're a longhorn. Can you show me the hook of horns? All right. Once again, don't let me move you. Don't let me move you. Great job. You can relax. All right, Christina, so we're going to test some more muscles in your hand. What you do is I'm going to push your finger in and don't let me move you. Excellent. And I'm going to push your middle finger towards you. Don't let me move you. And I'm going to pull it back towards me. Don't let me move you. Excellent. I'm going to pull it back towards me. Do not let me move you. Perfect. Good job. All right, Christina, so we're going to try some more testing in your hand. If you could, put your elbow up just like this. Perfect. Now I'll need you to hold your hand together, and I'm going to try to pull out. Do not let me move you. Good. And then on this finger, don't let me move you. Okay. And this finger, do not let me move you. Okay. Good job. You can relax. Okay, so if you could turn your palm face up for me, hold it down here, And if you can raise your pinky, flex it toward you, great. And keep it up, please. And hold it there. Do not let me move you. Great. Now turn your hand over, face down. And if you can, move your pinky out for me. Excellent. And hold it there. Do not let me move you. Perfect. Good job. You can relax. All right, Christina. So if you could, raise your arm, your elbow. Perfect. And you touch your pinky to your thumb for me. Great. Okay. So I'm going to ask you to hold it right there and do not let me move you. Perfect. And keep that position, please. Hold it right there. Do not let me move you. Great. Good job. You can relax. Okay, Christina. So if you can put your palm straight up for me, and if you can bend your thumb in for me all the way. Perfect. Now if you'll hold it there and don't let me move you. Excellent. Now if you can bend just right here at the thumb, the tip, and hold it there. Do not let me move you. Excellent. Good job. Okay, now can you put your thumb up for me? Excellent. Now hold your thumb just like this. Do not let me move you. Good. And again, this time, don't let me move you. Perfect. Good job. You can relax. All right, Christina, can you put your hand flat on the table just like this? Great. And put your fingers and thumbs all the way together. Fantastic. Now, if you can, I need you to hold your thumb. Do not let me move you. Perfect. Now, if you make an L with your thumb all the way out. Hold it there. Do not let me move you. Good. And you can put your hand up like this. Hold it there. Do not let me move you.